Thank you for joining us. I'm Ed Highland, and we continue this premier event with an exciting lineup of activities coming up on ASA TV. Government-funded healthcare and anesthesiology. It's an international perspective in successes and failures. And listen in on the captivating QCDR reporting panel. They will talk about the ASA QCDR, a PQRS reporting service free to all ASA members. On your mark, get set, go! We begin day 2 of the 2014 ASA Annual Meeting with a Run for the Warriors. This is the 5th consecutive year ASA has sponsored this Hope for the Warriors event, and runners including meeting attendees, exhibitors, local residents, and military personnel all ran in support of the wounded warriors. We celebrate their strength and resolve with the intention to continue restoring self, family, and hope. Switching gears and heading indoors, we continue our run in the Connection Center. We're here on the show floor where the excitement is evident. There are many benefits to being here at Anesthesiology 2014, including the poster presentations you see here behind me. The poster presentations are a great insight into many industry topics such as critical care, patient safety and practice management, among others. The intimate presentation allows for attendees to get an in-depth conversation on the topic specialty.
I think the poster presentation format is a very effective means of communicating important scientific information that's coming out of the activities in anesthesiology.
I'm seeing all sorts of stuff that I wouldn't expect. So management of carotid body tumor that's unexpected, management of OB hemorrhage that I wouldn't have expected. So it's been exciting and good.
Continuing our walk through the Connection Center, you have the ability to view medically challenging cases that provide physicians a forum to share experiences, discuss challenging situations they've encountered, and receive feedback from their physician anesthesiologist peers.
See, the kind of work that America is up to and the kind of work that we are there, we probably, you people set up standards for us that how we are supposed to do things at our side. But there are some things that the patient population that we cater to, some cases rheumatic heart disease, some patient populations which are probably not seen on this side is what we try and bring to you and showcase here.
In the medically challenging case venue, we are seeing cases where there's something that's really different and they learn how to manage it. They're seeing things that we don't typically see. If you look at the other posters throughout the session, we're seeing patients who are presenting preliminary data on studies, some of the research that's been done. So this is a wonderful opportunity, really and truly, for our membership to engage in this process. It has benefits that go far beyond today.
This is only one piece of the puzzle of the show floor. We have ASA's Jackie Herrera standing by with much more from the Connection Center. Jackie?
Thanks, Ed. You're right. You know, the Connection Center is the place for attendees to go and learn about anesthesia-related innovations, as well as interact with their peers. I'm in the middle of the ASA Connection Lounge, where attendees can go to relax and recharge in the middle of the hustle and bustle of the show.
The education found at ASA is innovative, one of a kind. We continue our education in the specialty sessions. With representatives from 90 countries here at Anesthesiology 2014, it was the perfect opportunity to better understand how government-funded healthcare and anesthesiology is working and not working in other countries. This international perspective session brought a panel together from Canada, Norway, and Mexico to highlight the differences and a common goal: best patient care.
It seemed to me that there are countries that have had decades of experimentation with different models of government funding of healthcare and in particular anesthesia care. And this was an opportunity to get our neighbors in the north, in Canada, and the South Mexico, which have embarked on very different funding models.
Moving on to neuropathic pain, it's an important topic among physicians, and session speakers Drs. Chang, Lubenow, and Peng focused on the importance of treatment options for PN. There are two goals: to try and alleviate or eliminate the cause of the underlying disease, and to relieve symptoms. Ultimately, they say that the key to safe and cost-effective management of neuropathic pain is to have a multimodal strategy versus monotherapy. Money is at stake unless eligible professionals can justify the quality of care they provide for patients. The QCDR reporting panel aimed to answer the many questions still out there about the Medicare physician fee schedule and how ASA members receive an important benefit by reporting through ASA's own QCDR.
Because it's a member benefit, you're already paying for the service. And if you go any other route, there are some other routes you can go for, but you're going to have to pay more than the $295 per provider on all of your providers.
An overflow crowd turned out for insights into intubation with a humorous twist. Will Rosenblatt led the discussion based in part on the wit and wisdom of his mentor, the late Andy Osapian, a member of the Difficult Airway Task Force. Dr. Rosenblatt used the approach of what would Andy say when it came to choosing between awake intubation and intubation post-anesthesia.
Every clinician who evaluates an airway is going to look at it and bring to that airway their past experience, the equipment that's available to them, and the situation of the patient, whether they're NPO, whether they've had prior surgery, whether they've had radiation. And the individual clinician has to come up with an airway plan based upon their own experience and skills.
We're back at the Connection Center, and we wanted to know, why do you attend the show?
Number one, it's a good, opportunity to, get the full download of what's going on in the variety of what people are doing in anesthesia and sedation. And for us, it's also a good platform to present what we can contribute.
The benefits are you get to know the latest equipment, the new techniques, and what's going on in the world of anesthesia.
New products, find out what's going on, and also get into some very good lectures, because all of the information that you get here is very up to date.
The technology you'll see on the show floor is helping physicians in their practice as well as their bottom line, which is patient safety. Ultimately, the ASA goal is to bring together all components of the industry in order to provide guidance, improve decision-making, and promote beneficial outcomes for the practice of anesthesiology. President of ASA, Dr. Fitch, has been striving to maintain that goal for the last year, and we had a chance to catch up with her and her thoughts on the ASA.
I think we have the absolute best medical specialty that there is. We have the best staff. We have the best medical specialty organization that there is, and we have the greatest members. We have such volunteer spirit among our physician leadership. It's just so rewarding, and always putting patients first is what leads and drives us every step of the way. So I think we're well positioned to survive and thrive in the future. I'm thankful to have played a role at this point in time and look forward to continuing to help in any way I can.
It's been quite the eventful day. Join us tomorrow for insight into 5 years of the AQI. What do we know about ourselves? Or learn about the basic science to clinical practice, the tale of long-acting opiates in the Severin House Lecture. These sessions and so much more. For ASA TV, I'm Ed Highland.